Welcome, everyone, to the Preschool Mindfulness Summit 2019. I'm very excited to introduce Dr. Ronald Siegel. He joined us last year as well on the summit, and we had a great response from him. So thank you again for joining us and coming back and sharing.
Happy to be here.
Thanks. So Ron is an assistant professor of psychology part-time at Harvard Medical School, and he also serves on the board of directors and faculty for the Institute of Meditation and Psychotherapy. He's an author of several books. He has the book, The Mindfulness Solution, Everyday Practices for Everyday Problems, which I highly recommend. Very good practical book. And he's the professor for the science of mindfulness, a research-based path to wellness, to well-being, which is one of the great courses, which are always very practical and good for people to join and learn more if you're interested in a particular topic. So welcome and thank you.
Thanks for having me.
So Ron's topic today is mindful parenting of preschool children. He also has given us a free video on the science of mindfulness, which you can watch later, that we'll have a link to. But let's just start by asking, why focus on parenting?
Well, part of my professional career was spending 25 years mostly as the chief psychologist at a parent guidance clinic and a child and family mental health clinic. And, you know, originally back in the Jurassic period when I began my my clinical career, there's a lot of emphasis on if children were emotionally distressed or were behaving poorly, having difficulty getting on with others, we need to understand the child's feelings, and indeed we do. And there's a lot of emphasis on individual therapy for kids. And what I came to realize over the course of decades of work was that even if I or one of my supervisees was a dynamite individual therapist who could absolutely empathically understand the child's needs, connect with them, help the child feel heard and seen, as powerful and therapeutic as that might be, if during the course of the therapy, let's say we resolved, we'll call it 1 unit of emotional distress, but during the intervening week, the child was accumulating 1.5 units of more emotional distress, well, the trajectory wasn't going to be good. But if we could do something to help the essential people in the kid's life, whether it be parents, and it's primarily parents, but other caregivers as well, including teachers, if we could help them find a way to respond to the child that was optimal, kids would get better. That, I came to the conclusion that most kids need the metaphorical equivalent of air and light and water and fertilizer, and nobody like yanking them up by the roots. And given that, most kids will thrive. And even if they've had difficult trauma in the past, yes, they may need some help around that. But the most important thing is developing the optimal caregiving environment around them. And while mindfulness practices can be enormously useful for preschoolers, and I'm sure that you have other participants, other guests who are going to talk about clever ways to do that, clever ways to adapt the adult practices for kids, something else that can be enormously useful is helping the parents and teachers and caregivers to use mindfulness practices to be able to be more optimally present with kids.
Right. Yeah, I think that's very true, isn't it? Sometimes we just want to stick a Band-Aid on and fix this little problem, but there's, or maybe a bigger issue going on. And when we bring all those parties together, we can really help the child to flourish.
It's also that, we just have, as parents, particularly with preschoolers, we have such a powerful influence. I happen to be the father of twin daughters. And my wife's wife's also a clinical psychologist. And we noticed a correlation that was so tight, it was clearly causal. When my wife and I were having difficulty getting along, when we were, bickering or annoying one another, whatnot, and that happened because, having two little kids to take care of, even though it was just us two and them two, we often felt outnumbered. When we were having difficulty, their behavior deteriorated. They slept less well. They were emotionally more dysregulated. They had more trouble. The moment we got on track and we found a way to really understand one another and be on the same team together, their behavior improved. It was really easy to see the connection that when we were saner, our kids simply flourished more. When we were less sane, our kids flourished less. And mindfulness practices have tremendous potential for helping us to be saner as parents.
Yeah, and I think we see that in the classroom as well. If a teacher is having a hard day, we see, the kids don't do as well. And I think there's some research even showing, like, if a teacher's cortisol level goes up, the students in the class, cortisol level goes up as well, which is, surprising, and shows us how important it is to kind of get strategies to manage ourselves.
Well, we're exquisitely attuned to one another, and it's so interesting if you look at the broad scope of psychological research on what are the factors that predict well-being in kids and then help kids to grow into adults that have more well-being rather than less. Of all the things we can measure, there's one that has stood out over and over and over as a predictor of psychological health. And that's what we call secure or organized attachment as a child. And I imagine other speakers have spoken about this, but attachment is sometimes misunderstood. Sometimes people think, attachment is about clinging or dependency. And attachment is really about the ability to use another for our own emotional regulation. So in the classic studies of attachment, what you do is you take a preschooler, actually, or even perhaps before preschool, it's 18 months old often, and you put them in an emotionally stressful situation, which is usually having the caregiver leave, and then you reunite them with the caregiver. And what you're studying is how well can the caregiver then soothe the child? How responsive is the child to that? How much can the child use the caregiver's presence to emotionally regulate themselves? And, any of us who've taken care of preschool kids know that this is critical, that if we can be present in a way that allows the child to regulate as we hold them and hug them or talk to them in a soothing way, that plays an enormous role in their overall stability and their well-being. And what we see when we look at developmental research over the course of the lifespan is those kids who were able to be soothed by caregivers, they're the ones who flourish. And the ones who weren't, and it can be for one of, a couple of different reasons. It could be that the kid has had some very difficult experience already in their life, so it's hard for them to take it in, or it could be because the parent's having difficulty providing that emotional ballast, that ability to really communicate, it's okay, sweetheart, and for the parent to tolerate his or her own feelings of distress that happen when a child's distressed. And when that works well, boy, all sorts of good things happen. Kids and adults are able to have sustained relationships. They're able to thrive at work. They have fewer stress-related medical disorders. So many benefits come from it. But when it doesn't go well, there's a lot of problems that come from it. And I would argue that mindfulness practices are great training for allowing caregivers to provide the experience of secure attachment to young children.
Yeah, I totally agree. Can you give us some examples or explain a bit more about how mindfulness can help us with these preschool children who we know are going through all different stages and emotions and learning very quickly? How can is it our practice ourselves, or is it teaching practices to the children? Or is it both that's going to help them most effectively?
I think both can be helpful, but My guess, and I don't have research to back this up, but this is my clinical experience, excuse me. My guess is that we get the biggest result per unit of effort with our own practice as caregivers. And that's because the critical thing that we need in being able to respond to kids are two things, essentially. One is we have to be attuned to them. We have to be able to notice what they're feeling and be able to respond empathically to what they're feeling. The second thing is we have to be able to tolerate the feelings that come up in us. When I think of my many, many mistakes as a parent, a friend of mine, a mindfulness teacher named Trudy Goodman, who founded Inside LA, in the Los Angeles area, she coined the term parenting crimes. Those are all the things that we've done that we can't believe we've done because they were so not helpful as parents. And I got to tell you that being a clinical psychologist kind of compounds it because I'm supposed to know better. And being a psychologist with child training makes it unconscionable that I would have done these things. But so when I go back and I think about these parenting crimes, and luckily they're not at a level that got me reported to protective services, but still, they were clear errors. When I think about these errors, not a one of them came because I sat back, thought, I wonder what the best way to respond to my child would be in this moment. I wonder what the balance of love and limits that's needed here would be. They've always been because I got overwhelmed by some feeling and I impulsively responded to my kid in a way that wasn't helpful. So if we're not going to do that, if we're going to instead respond empathically and creatively, we need to be able to tolerate our feelings. And one of the wonderful benefits of mindfulness practices is they train us to be able to have what psychologists call affect tolerance, the ability to be with and bear a feeling when it arises. And they train us in several different ways. One of them is that when we're doing mindfulness practice, one of the practices that almost all of us learned early on is if you're sitting there and an itch or an ache arises, instead of impulsively and compulsively, as we normally do, scratching the itch, or changing our posture to try to resolve the ache, try an experiment. Try simply turning the attention to the sensation of the itch or the ache and be with that as the object of attention and see what happens. And most of us find when we do that often, not always, but often the itch or the ache transforms by itself, right? And that becomes a great lesson because it means, oh, well, when bodily discomfort arises, we don't necessarily have to do something about it. We can just kind of be with it. One of the things we discover through mindfulness practice is that all of our emotions are basically somatic experiences. So if our listeners right now, or you could join me in this, close your eyes and take a moment to generate a little bit of sadness and feel where that is in the body. And perhaps touch where you feel that. For me, it's kind of in my belly or my chest area. Or take a moment to feel a little bit of anxiety and notice where that is in the body. Perhaps touch that area. For me, it's a little bit more in the chest area. Or anger or irritation. And where's that in the body? Well, for me, it's kind of in my shoulders or around the neck area I feel that most. And you can open your eyes again. But the point here is that all of these emotions, and I named some that are difficult for us and that sometimes drive us to be reactive, right? All of these emotions, they're basically bodily events accompanied perhaps by an image or a thought. Most of us generate a thought, use a thought or an image to generate the feeling. Excuse me again. in this exercise. So if we're able to simply be with the sensations of anger or fear or sadness, rather than feel like we have to do something about it, in the same way that we can be with the itch or the ache and learn to tolerate and ride it out, this is one way that mindfulness practices really help us to be able to tolerate our feelings. The other way they help us is that all of our feelings are tightly interwoven with thoughts. This is why there's a whole giant branch of clinical psychology, which is cognitive behavior therapy. The idea is, well, if we can help people change or get perspective on their thoughts, that might change their whole emotional life. And indeed it does. Because if we, right now, again, I invite our watchers, to do this, take a moment to think about something that's upsetting to you. Shouldn't take long, right? They're ready at hand. At this moment, sitting right now or standing wherever you are, being with this video right now, at this very moment, if it weren't for the thought of that difficulty, would you be having a problem? And the likelihood is no. Even if what you're dealing with is actual physical pain right now, it's probably the thought that, oh, I don't know how I'm going to resolve this. I hope this doesn't last forever. That's causing the emotional distress. So we start to notice, all of our emotional distress, all of our emotions are triggered by thoughts. Now, most of the time when we have thoughts, we tend to believe in them. We tend to think, oh yeah, I have a terrible problem here. This is a bad situation. That person is being a jerk. He hurt my feelings. She's really scaring me. We actually believe in the content of our thoughts. And when we believe in the contents of our thoughts, the emotions that go with them come in so much more powerfully, and we feel compelled to act on those emotions. The more we practice mindfulness, virtually all mindfulness practices include this activity of watching thoughts come and go, right? We stay with the breath or sounds or the taste of food or the sensations of our feet walking on the ground, and we simply observe thoughts coming and going. We usually use metaphors like something like clouds passing through a vast blue sky, right? And the more we practice watching them come and go, the more we develop what actually cognitive behavior therapists call metacognitive awareness, the ability to see a thought as a thought rather than identify with it and believe in it as a reality. The more we can do this, the less we get emotionally triggered, because the more we see, okay, here's my kid behaving in this way. I'm starting to have the fantasy that they're going to grow up to be a criminal or a drug addict because they're not following my instructions, or they're being mean to their sister or some such. That's a thought. That's a fantasy. I feel the emotion going with this, but I can bear this. I can be with this. I don't have to immediately react to stop my kid from doing what he or she is doing out of my fear of this whole elaborated fantasy. And the more we can see that, oh, we get triggered by our kids all the time, mostly we're triggered because we're decent people, actually. We're triggered because we want our kids to come out okay, and we're terribly afraid that this behavior is going to turn into something awful. And the more we can see that, notice our fear, and practice, there's a wonderful little acronym that I sometimes share when training psychotherapists, and the acronym is WAIT, WAIT, and it stands for why am I talking? Which, as a therapist is like, okay,
Yeah.
What are you doing here? Is this actually going to be helpful to a client or patient, or is this because you're trying to prove to yourself that you have something useful to offer? You're, in some way trying to, buttress your sense that you're okay as a therapist, or is this actually useful? Well, similarly, as a therapist, as a mom or dad or teacher for that matter, why am I talking? Why am I intervening here? Is this because I'm panicked, or is this actually going to be useful for the child? And having that moment to pause, to think, to reflect, that's what's so critical. And mindfulness practices are just great training for that, because they really teach us to notice the feeling arising, noticing it as a bodily sensation, notice how it's triggered by the thought, but thoughts come and go, so they don't necessarily reflect reality. This gives us tremendous psychological freedom, not to have a reaction in our heart and mind and body, but to choose whether to act on that reaction or not. Because very, very few, as I mentioned before, very few of our parenting crimes came after a moment of slowing down, feeling what's going on, and deliberation.
Yeah. Yeah, I think we're all guilty of those parenting crimes. I love that word, where you think, what was I thinking? How did that happen? But you've given us some really good insight there into why we do things and how we can maybe slow down and and use mindfulness. What would you say to, we have lots of parents watching, teachers watching, who are all super busy, and they say, I just don't have time to do this mindfulness thing. You know, we keep reading about it, but I'm just too busy.
Well, you know, there's a wide variety of mindfulness practices that are available to us, thousands actually. And they fall into two broad categories. One category is what we might call formal meditation practice, where we're taking time out of our day to sit somewhere or do some very slow walking practice, or perhaps doing some yoga practice, and in which the whole goal of the activity is to develop mindfulness, this capacity to be aware of present experience with acceptance. But there are also informal practices, and informal practices refer to things that we can do during the course of our normal lives in which we shift our attitude or our focus in order to develop mindfulness. So when driving to work, when walking the dog, when doing the dishes, when cutting up the vegetables, we can be, you know, listening to the radio or music or something like that. Or we can decide, you know, this is essentially a sensory task in which I don't have to make a lot of higher order executive decisions. I can use this as an opportunity to bring my attention to the moment-to-moment sensations of what I'm doing here, and to allow the thoughts to come and go, but to continue to return my attention to the sensations of the moment. And while we don't have a lot of data on the effects of these informal practices, we have much more data on the neurobiological effects of the formal practices, as well as the clinical benefits in terms of helping us with our psychological distress of the formal practices. The informal practices certainly do seem to be a step in the same direction. They certainly do seem to help us step out of the thought stream, stay with what's happening on a sensory level, moment by moment, and notice all of the thoughts, feelings, and impulses that arise in the heart and the mind. So there's a lot of activities we do that, you know, don't require talking, don't require, higher analytic functioning, that we can do as mindfulness practices. And I would say, you know, if you're totally busy with kids or your classroom or whatever, do that, because that's at least a step in this direction. And even just having the intention to be mindful when we're interacting with kids can be tremendously helpful.
I was just going to say, I was just in Hong Kong in the classroom recently, and they were saying, you know, even just at the start of, you know, when the kids come in and they do circle time and they just do a few breaths together, and the teacher does it obviously as well, and that just small thing makes a difference in the morning, in the feeling of the classroom. So
yeah, it frames an intention. Yeah. To pay attention, which can be really, really helpful.
Yeah. So some people ask, you know, how long does this take before I see my results? Or I know it's very individual, but is there any research showing kind of how is it? We know it's not instant, but I think it happens quite quickly, doesn't it, when you start to use these practices?
You know, the way I think about this, I mean, what we know from research, we don't know, for example, whether mindfully cutting your vegetables is going to create change in brain function and brain structure. It feels to me like it does, just from personal experience, and others report the same, but we haven't tested that. We have seen neurobiological tests that show that as little as 20 minutes a few times a week starts to change brain function and brain structure. But the way I think about this is very much the way we understand taking up physical fitness. If you go from being really sedentary to just beginning to take a walk for 15 or 20 minutes a few times a week, the benefits to health are really quite substantial. Going from zero to something in terms of physical activity is quite impressive in terms of how it benefits longevity and is protective against various diseases. If you move from that to actually, working out and breaking a sweat, that's another big quantum leap. But there's a big quantum leap from zero to something. And I find the same thing's true with mindfulness practices, that going from zero to something starts to shift how we relate to the world and starts to shift how we relate to kids and how we relate to our own emotions. Indeed, if we take time out to actually meditate each day, we're going to have more profound results. And going off to a silent retreat where we sit all day and practice, we notice it's radically transformational. So this is very dose related, but the small dose is still a very valuable dose, very much in the way that going from being sedentary to just walking a bit is enormously helpful for physical health.
Yes, that sounds very pragmatic, and we just have to kind of take it on board, I think, and start where we are and move forward, right? And not worry. People get caught up in, I need to read the book and take a course and do all things that you can actually start, as you mentioned.
That will help. It will provide more support, more structure, but you can start very small.
Yeah.
The other thing that I want to mention is, and I don't know where we are with time for our interview.
A few more minutes, yeah.
Okay, we have a few more minutes. Coming back to the parenting crimes, and I guess since many of our listeners are teachers as well, let's call it teacher crimes as well. They're quite similar, I believe.
Feel included, yeah.
Almost all of them occur not only when we're acting on impulse, but when we're taking what's happening personally. It's so interesting that when we feel that what's happening in some way reflects on us, we get so much more reactive. If my kid or the kid in my class is, cranky, or they're having difficulty, and I know it's because they've got a cold, and I'm just thinking, well, they've got a cold, I'm going to do the best I can, I will handle it much better than if somehow I'm feeling it's because I'm not being a good enough parent, or I'm not being a good enough teacher, I'm blowing this. And then my whole self-esteem starts to tank. I start to worry that I'm not good enough. And so many of the mistakes we make because we have difficulty tolerating that feeling. To use an extreme example just for illustration, when I worked in child community mental health, we worked with a lot of abuse cases. And sexual abuse is its own animal, and that's quite complex. But physical abuse, which is really the next step in the kind of mistakes we all make as parents, right? It's instead of, yelling reactive, and as teachers, instead of yelling reactively at the kid or impulsively letting our anger or frustration take over, some people actually hit the child, and that's obviously much more harmful. But the interesting thing is in deconstructing moments of physical abuse and trying to get to the bottom of, so what went on here? Almost always the parent was feeling humiliated. Wow. Almost always they were feeling so disempowered, so ineffective, that when a 3-year-old child's will appeals to be prevailing over our will, that can feel demeaning to us. That can make us feel very humiliated. And I think so often when we react in a way that's not helpful, it's because we can't tolerate that feeling. Sometimes it's because we can't tolerate the fear that the kid's trajectory is bad, or, the sadness of the kid's pain. Absolutely. But the really big parenting crimes, I think, mostly come about when we feel humiliated ourselves. And one of the other enormous benefits of mindfulness practices is we come to see ourselves and our emotional reactions as interpersonal events in this primate, right? I know we like to think of ourselves as being way more sophisticated than the other primates because, we have less hair and we're smarter and, we can do Zoom interviews. But when you get down to it, so many of our instincts are the same as their instincts. Yeah. And when we feel, primates, when they feel their rank in the primate troop plummeting, they react in terrible ways. They get super reactive because they're just hardwired to care about, how they fit in and where they rank compared to the other monkeys. And we're the same way. And when we feel our rank plummeting, when we feel that, oh gosh, we're ineffectual, or we're being defeated by a 3-year-old, or we don't know what we're doing, that self-esteem hit, because the way it works in humans is our rank in the primate troop in humans, we experience this as our self-esteem going up or down. Oh, people love me. They think I'm competent. They think I'm great. They invite me for Zoom interviews. I must be special. That's, I'm wonderful. And my rank's going up in the troop. Oh, a 3-year-old is defeating me. My rank is going down in my imagination. And these experiences are so at the heart, I think, of so many of our mistakes and mindfulness practices can really help us to see how this works, to help us to see, oh gosh, yeah, my self-evaluations are going up and down all day long, aren't they? And they're going up and down all day long when I'm with my child or with my classroom. And these are causing a lot of my reactions. And if I can see this more clearly, it's just much easier to not take it so seriously, to understand that, okay, that's fine, okay, I feel bad about myself right now, but this always fluctuates and I'm going to be okay. And I'm still perfectly okay as a teacher or a parent, whatever. I'm just having a bad moment here. And mindfulness practices, I think, really help us to keep that in perspective as well.
Yeah, that's such wonderful advice, Ron. I love that kind of acceptance, and then that self-talk, saying, it's just a moment. It's going to pass. It doesn't mean you're the worst parent on earth. And sometimes, we beat ourselves up. So I think, as you say, these mindfulness practices can help us to kind of see that it's a natural kind of up and down, as you mentioned, and help us not react as we might have in the past. So thank you so much for sharing all those ideas with us and your knowledge and your stories. I really appreciate it, and I'm sure our readers will too. And just remind everyone to check out the video that Ron has provided for us, where you can learn more about mindfulness. And he also runs lots of courses and retreats, so check out his website and his book, and you can learn more from him if you wish to do so. So thank you again for coming on and sparing your time for us.
You're very welcome, and thanks again for having me.
Thanks. Thank you.